Hello, my name is Julio Valdivia. I am performing a remediation video on my drawing up insulin video. I was told to begin my video at determining my patient's blood glucose and when his next meal is, so I'm going to go ahead and start from there. Hi, Mr. Smith. So we have looked at your blood glucose. It is at 160, which is high. We normally want blood glucose levels to be at 100 or below. So to go ahead and help you treat that or regulate that, we're going to be administering some medication, okay? Before that, I'd like to know when your next meal is, Mr. Smith. Okay, Mr. Smith states that his next meal is in 30 minutes, which is perfect because insulin is to be injected into a patient 30 minutes before their next meal. I'm going to ask Mr. Smith some further questions as well as inform him on the medication that he's to receive. So, Mr. Smith, I'd also like to know, do you have any known allergies to food, drugs, or the environment? No? Okay, perfect. So what I'm going to administer today to you, Mr. Smith, to regulate that blood glucose is insulin. Insulin acts in the body by allowing cells to take up some of that glucose in your blood and use it as energy, and it's going to help us regulate your blood glucose, okay? There are some side effects and adverse side effects to receiving insulin. The side effects are a little bit more common than the adverse side effects, and the side effects are dizziness and nausea. The adverse side effects are hypoglycemia, which is an extreme drop in your blood glucose, and hives, which are an allergic reaction. It presents itself as rashes on the skin that become red, and they can become itchy as well. So if you're feeling any of those side effects or adverse side effects, you just let me know, and we will go ahead and take care of you from there, okay? Also, Mr. Smith, when receiving injections, you can feel stinging or burning at the injection site, but that's completely normal, and it should subside pretty quickly, okay? Do you have any questions for me at the moment? No? Okay, perfect. So at this point, I verified that my patient's blood glucose is high. I verified the next time he's going to eat his next meal, which is in about 30 minutes. So I know that it is appropriate to administer insulin to Mr. Smith at the moment. He's informed about the drug, as well as I am informed that he has no known allergies to the insulin, so it seems to be a safe procedure for Mr. Smith. And I'm going to go ahead and move on to drawing up the insulin itself. Before I came into the room, I've checked my medications up to the MAR. I have two medications, or two types of insulin that's going to be mixed into one syringe for the injection. It's intermediate insulin, which is this cloudy one here, and regular insulin, which is this clear one here. Because I am mixing these two, I need to perform a calculation on the dose of medication that Mr. Smith is to receive. So I'm going to have a second nurse come into the room with me and verify the correct dosage. I'm going to check the MAR for how many units of each type of insulin he is to receive. He is to receive 4 units of regular and 8 units of the intermediate insulin. I'm going to go ahead and do my calculation. My fellow nurse is going to do their calculation. We're going to compare once we are finished. I have 12 units total, 8 of the intermediate plus the 4 of the regular insulin for a total of 12 units. My fellow nurse has the same thing, so I'm going to go ahead and thank them and continue with the procedure of drawing up the insulin itself. So at this point, I'm at the bedside. Mr. Smith is informed. I know I have the correct patient. I know I have the correct drugs, the correct dose, the correct route, the correct time, and the correct documentation, which are the 6 rights of medication administration. I'm going to again check my intermediate insulin up to Mr. Smith's MAR. I'm going to check the regular insulin up to Mr. Smith's MAR. I have the correct medications. I have my correct calculations on the mixture of these two medications. So I'm going to go ahead and proceed with the procedure. I'm going to perform hand hygiene. I'm going to don a pair of clean gloves. Now, insulin tends to, or the vials of insulin tend to settle at the bottom. So I need to disrupt that settlement in the insulin and get it back up into the solution. So for that, I'm going to roll the two vials in my hands, just like that. Next thing I'm going to do is I'm going to open an alcohol prep pad. This is to clean the tops of the vials. Throw that away. Clean off the top of each one. Throw that away. Allow that to air dry. And I'm going to go ahead and prepare my insulin safety syringe. This is marked up with 100 units. I only need 12. This is the correct syringe. I verified that it's marked up to allow me to measure 12 units, as well as it has the correct needle on it, which is a 29 gauge, 0.5 inch. This is appropriate for administering insulin. So I'm going to go ahead and open this up. Here's my syringe. I'm going to go ahead and again verify these up to the MAR. It's correct intermediate and the correct regular. I'm going to be drawing up into the syringe my regular insulin first, and then I'm going to be withdrawing the intermediate insulin second. So at this point I need to add some air into the intermediate insulin vial first. It's going to need 8 units of air into it. So I'm going to go ahead and withdraw 8 units of air. I have 8 units of air in my syringe. I'm going to go ahead and remove the cap, place it on the table to assist with one-handed withdrawing techniques. I'm going to go ahead and insert the needle into the vial, and then insert the air into the vial without allowing the needle to touch the medication itself. I know I'm going to need 4 units of the regular insulin, so I need to withdraw 4 units of air into my syringe to add to the vial. It's 4 units of air. Go ahead and now put that into my regular insulin, which I'm going to check to the MAR, correct insulin again. Okay, now I'm going to withdraw the actual medication, making sure to not allow any air bubbles to go into my syringe. And if I do see air bubbles, I'm going to go ahead and tap them out until I receive 4 units of regular insulin in my syringe. There it is, 4 units. Make sure there's no air bubbles in it. Now, before I withdraw my intermediate insulin, I'm going to check it up to the MAR and make sure I have the correct one. It is. I know I need to withdraw 8 units of this one for a total of 12 units, which I saw on my MAR. I know I need a total of 12, so there's 4 in it now. I need 8 more, which is going to be the intermediate insulin. I'm going to go ahead and pierce the vial with the needle. I want to make sure that I do not push down on the top of on the plunger of the syringe to release any medication, any regular insulin into the intermediate insulin. Now I'm going to flip the vial and withdraw the 8 units for a total of 12. Tap out any air bubbles. Alright, so now I have a total of 12 units in there. I'm going to recap my syringe using the one-handed technique. Now the reason I withdrew the regular insulin first is if the if you withdraw intermediate insulin first, any intermediate insulin that is on the tip of the needle can destroy the function of the regular insulin or have effects on the regular insulin. So it's important to always withdraw regular first and intermediate second. Now that I have 12 units, show that to the camera. 12 units of the combination of insulins. Again, check that up to my MAR, make sure I have the correct amount. And of course I do. I know that everything is okay. I've done my correct calculations. I know that I've used the correct drug at the correct dose. The mixture was correct. I've checked the vials up to the MAR multiple times. I have the correct amount of insulin in my syringe, the correct patient at the correct time. And the withdrawing of insulin is complete. Now I can remove my gloves, throw these away. And if this procedure was done not at the bedside, say it was done in the med room, I would of course label this syringe with my patient's name as well as the drug and the dose that he is to receive before I exit the med room and take my syringe to his room. At this point, perform hand hygiene and document the procedure.